I'm Dr. Tom Essex. I was Chief of Staff at Grady Memorial Hospital in 2014 and 2015. So when the inspection happened, I was the Chief of Staff. The operating room was closed because, in the view of the inspecting nurse, it posed an imminent danger to patients. One of the things that you have to understand is that there were a number of surgeons working in the operating room. There were surgeons who are based in Chickasha, and there were surgeons from Oklahoma City and surgeons from Norman. None of those surgeons felt that there was any danger to patients in that operating room. If they had felt there was a danger, they would have been in Mr. Spellman's office, and they would have been talking to me, and above all, they would have refused to do surgery there. They have a moral, ethical, and professional duty to their patients to take care of them and make sure that they have optimum results. That judgment on the part of a nurse was ill-considered and uncalled for. And it was really a slap in the face to all the professionals, nurses, surgery techs, and doctors who worked in that facility, because it was patently untrue. We have data going back years which show that our infection rate is better than the state average and the national average, much better. And so the fact that she could make that decision without ever seeing the data just speaks to how arbitrary this process was. Another question that I've heard in the community is, why wasn't this anticipated? And frankly, it wasn't anticipated because we had already done our homework. We had brought in an outside agency to conduct a mock survey shortly before this happened, and they had felt confident, the outside agency felt confident that we would pass with flying colors. We had previous surveys that were never a problem. We had not made any changes in our OR that would cause us to think that it would suddenly become an issue. So based on everything that we knew, we had no idea that they were going to come in here and do this kind of hatchet job. It really is this whole thing is just a ball of worms. Effectively, CMS came in and cut off the part of the hospital that makes the profit. The clinic mostly pays for itself. The hospitalist side, the medical side, mostly pays for itself, but the profit is in surgery. And so when they came in and said this surgery is not going to be able to function, that amputated the hospital's ability to make money. Now, we had saved money prior to that, but the idea that you can just snap your fingers and fix one air conditioning unit and you're going to meet the state's requirements is a fantasy. These people came in and without any real reason took the surgery offline. They're not going to be happy with just patches. You know, they've demonstrated that they're not going to be happy with that. They demanded that the flow be changed, and what's that saying is, we want you to rebuild this OR. If you have to change the flow, you have to tear out walls, you have to change plumbing. There's a lot of things that have to happen, and that means that whole area is going to be offline for 18 months. And when they come back in, there's a real potential that they say, we don't care for this, we don't like your plan. And that's the other thing I don't think the community understands, that we're at the mercy of the state health department in terms of how long this process takes. We submit a plan to them, they review it, it takes a month, 2 months, 3 months for them to get back to us. We have a deadline of a week or two. We send them our plan, and then they have as long as they want to take to answer. Meanwhile, we're hemorrhaging money. So it's not something that you can just go in and patch. Patients, and have had patients who drive through Duncan from Comanche and down in that area to come to Chickasha. You know, I mean, traditionally, this place has been, this has been the medical mecca for everything in the southwest part of the state, practically. You know, now admittedly, folks west of Lawton tend to go to Lawton, but there's a huge population west and south of here who come here. You know, and that's because This has been where the doctors were for 100 years. I sat in the meetings where this proposal was discussed and debated at length. Additions and subtractions were looked at, experts were brought in and consulted, and the board really did everything they could to make this a viable solution. And I think the doctors, and I personally believe that this is the opportunity that we have, first of all, to save this hospital, and secondly, to give us a solid footing to go on into the future and build the kind of medical facility and medical staff that this community needs and wants.